Hi, I'm Dr. Tina Ramachander. I'm a consultant dermatologist with special interest in lasers and aesthetic dermatology. I practice at Dr. Tina Skin Solutions in Sakar Nagar, Bangalore. So under eye dark circles and eye puffiness is way more common than you know. So whenever you're stressed, you haven't slept well, you will observe that this under eye area looks more pronounced. And even if you have had a beautiful rested day, there will be some comments like, are you not well? You don't look okay? Is everything fine? So most of the patients reach out to us because they look tired, and the under eye area aesthetically needs correction in 3 different ways. When you talk about under eye dark circles, you are also talking about the pigment, the texture, and also the hollowness. So when you talk about the aesthetic improvement of an under eye area, we have to improve all these areas, and a clear understanding of the underlying area, the muscle, the skin, the bone, etc. is something which you need to understand. Whenever the bony protuberance is there, it casts a shadow on the under eye area, so that in itself makes it look darker. So tear trough is a depth here, the volume loss, which is normally present for a lot of us. It's a very normal thing to have, but with aging it starts to get more pronounced. And of course the pigment related changes. What are the causes for this? One is hereditary, the anatomy which you cannot really do much, but you have to do some interventions to correct. You can have a deficiency of hemoglobin and thyroid or vitamin B12, which can show there. For a lot of people, when there is the pollen season or the summer season, there is a bit of irritation and you continuously scratch this area. That also can cause inflammation and then pigmentary changes. For a lot of them, it's eye strain. You're constantly looking into the screen, there are glasses, and that in itself can aggravate this area. So when you come into a clinic with a dermatologist to check for this area, as I already told you, we evaluate on these 3 parameters, that is the texture, the pigment, and the depth. And we start with applications. In my practice, I find the application of vitamin K, retinol, and certain agents which are skin lightening agents, which done correctly for a period of 3 to 6 months, with also underlying issues being treated, people do see some efficient changes. If they are not visibly seeing the changes, the next step would be an intervention. And here I would like to share that a lot of people benefit by using pigment based Q-switch lasers, chemical peels, and along with that, nowadays the newest thing is applying bit of PDO threads inside the skin here, and somebody who's scared of using a filler, for such people the threads in the under eye area give great results. And of course, in the last but not the least, filler is a great way to enhance the volume and make sure this area is aesthetically corrected.